Okay, welcome to this week's COVID question and answer session with our public health reps. So this week we have a different face on the call. Geoff, did you want to introduce yourself?
Hello, I'm Geoff Barnes. I'm the Deputy Director of Public Health in North East Lincolnshire.
So, okay, I'll dive in with the first question. I know a fair few people who have tested positive for COVID, but have had things like fatigue, sore throat, headache, runny nose, but have not lost their sense of taste or smell, or had a cough or a fever. Would you recommend that people with these other symptoms try to arrange to get a test?
It's an interesting one. Obviously, the three classic symptoms are by far the most prevalent in relation to COVID. So a fever, a cough, or loss of sense of smell or taste. We do get occasional reports of people who don't have these symptoms testing positive for COVID, such as this. I think people need to make their own judgment to some degree. If they feel this is that they're feeling very run down and that they're just not themselves, then I think they can go and book a test just to exclude COVID on the basis that we are seeing examples of people not having those symptoms. And I think tests are now much more accessible than they were, say, 6 weeks ago. So I wouldn't discourage somebody from getting a test with those symptoms.
Okay, brilliant. Now this next question comes from the Grimsby Youth Zone young people, the group of young people that are working with us on the on-side youth zone plans for the town deal. The question is, what is the best way to protect yourself? Top 5 tips.
Okay. Hands, face, space. So keeping your hands clean at all times, wearing a face covering in public places, particularly indoor public places, maintaining that 2-meter social distancing as often as you possibly can. All those 3 things really, really important. A big one for me is following self-isolation guidance. So if you have symptoms, stay at home, self-isolate, book yourself a test. If you've been identified as a close contact, also stay at home and self-isolate for the recommended 14 days, and that can make a big difference. And the 5th one, maybe make sure you've downloaded the app. That can be really helpful in ensuring that if you have been a close contact, you will get notified and you can protect yourself and other people as well.
Okay. So the next question then, if I've been contacted by NHS Test and Trace and told to self-isolate for 14 days, I then get a negative test. Does this mean that I still have to self-isolate?
Yes, it does still mean you have to self-isolate. The nature of COVID is it has a very variable incubation period that can extend to 11 days or more. So you might have a test early in that incubation period and come out negative and then develop symptoms a few days later. The test does not mean that you do not have to self-isolate. There is a test coming, the lateral flow test, which gives a very quick answer, and I know the government are keen to see that rolled out in a way that it may be able to deliver on a very regular basis in certain areas or certain businesses or communities. So the guidance may change in time if we start to get the lateral flow tests in a big way, but certainly currently, no. If you test negative, do not stop self-isolating. You still need to self-isolate for the 14 days.
Okay. So next question, you might need your crystal ball for this. What tier will we be in when we leave lockdown?
Well, obviously we're part of the kind of Humber sub-region, and currently, I think as of today, North East Lincolnshire is reckoned to be the 7th highest in the country for COVID, and Hull is the highest in the country. We also have high rates in North Lincolnshire and East Riding, the other parts of the sub-region. So given as the decision, as I understand it, is going to be made early next week about which tiers authorities will come out at, I think it is highly likely that we will come out at tier 3, just based on the current figures and the fact that the Humber sub-region has just about the highest COVID rate in the country currently.
Okay, so lots of stark stuff there. I know that the epidemiology report for this week, the weekly report that shows the case rate for our area and lots of other things about the virus as well. I know that there was a glimmer of hope in there. Do you want to talk about that, Geoff?
Yeah, certainly. Certainly for the first time in many weeks, probably since the beginning of September, we had a reduction in the week-on-week numbers of cases. It had been going up and up and up ever since early September. For the first time, we've seen a slight reduction week-on-week. And a reduction in the oldest age group as well, which was particularly encouraging, given it's often the older people who suffer worst with COVID. However, even with that reduction, our rate is still extremely high, and what's been learned from other areas which have had high rates of COVID is that it's easier for rates to go up than to get them down, particularly at this time of year. So it's likely to be quite a slog to get the rates down to the sort of levels that I'd be comfortable with anyway. And indeed, the one age group where the rates aren't coming down, unfortunately, are the kind of younger age group currently. So we definitely cannot afford to start to think that this is anything like over. We've got a very challenging winter ahead, and we need everyone to follow the guidance as much as they possibly can if we're to continue to push that rate down over the next few weeks and months, to ensure that we can get through this without serious consequences for the healthcare sector and individuals.
Okay. Is there anything you want to add to sign off with?
Obviously, we're dependent on the public. We're businesses, we're dependent on community organisations to help us sell the message, particularly for me, as I say, around the self-isolation message, that if you are symptomatic, if you've been identified as a contact, please self-isolate at home. Please help your employees self-isolate at home. That can make such a massive difference at stopping the spread of the virus in our community. And if we can all pull together in that way as a community, then we will get the rate ever downwards, and come the late winter, spring, then there really will be light at the end of the tunnel for this. Hopefully the vaccination will be becoming available. The kind of change in the seasons will also have a real positive impact as well. So I want people to, I know I hear a lot of pessimism around COVID, but there really is light at the end of the tunnel. But certainly over these next 2 or 3 months, it is going to remain very challenging, and we need everyone's support to stay on top of this.
Okay. Geoff Barnes, thank you.